Kumbh Mela is the world's largest religious gathering. Millions gather from all over India and outside in search of divine blessings. In 2015, when Nasik's turn came to host the festival again, the administrators decided to face the mammoth challenges of organizing Kumbh with much grit.
It's going to be a huge mammoth task, and especially because in public health the entire responsibility of the welfare of the people who are coming in such large numbers from all over the country is on your shoulders.
Their motto was to save every single life and make the festival a pleasant one for all the pilgrims and visitors alike. Of course, this was anything but easy. Not only the event creates serious and uncommon public health challenges, Nasik also adds to the worry with its unique problems. Organized in the heart of the city, Nasik Kumbh holds the record for having the largest public gathering in smallest possible area, which is held in two different cities simultaneously, Nasik and Trimbakeshwar. Rainy season heightens the risks of infections and accidents.
And the state at that time is on its highest alert, especially all the public health institutions, because with rain comes a lot of spread of infectious diseases and waterborne diseases.
Considering all these and more, preparing the health sector for a mass gathering like this was indeed a Herculean task. The Public Health Department of Maharashtra, in association with the Municipal Corporation and Collector's Office Nasik, implemented a strategic and comprehensive healthcare plan to cover the ambit of health issues in Nasik.
So the challenges initially were to make sure that everything is in place on time. So every minutest detail has to be looked into, and you plan for it and you fund it.
Besides improving the capacity of existing hospitals, ad hoc healthcare facilities were created to provide essential services. Dynamic resource allocation in terms of manpower and supplies was done to match patient volume. The medical centers worked 24/7 during the Mela. Despite all these robust arrangements, one area still remained vulnerable: how to track epidemic. Historically, disease surveillance would entail manual data collection and a huge amount of paperwork. This whole process can significantly slow down disease detection. The need of the hour was to put in place some kind of real-time surveillance system that will help in taking quick decisions and prevent any epidemic-like situations going out of control. To address this need and to fulfill its commitment to saving lives, Public Health Department of Maharashtra collaborated with Harvard University Sai and UNICEF and implemented the Jan Swasthya project. The cornerstone of this project was a large-scale digital disease surveillance program called mCounter.
So syndromic surveillance entails looking for a cluster of signs or symptoms presenting to the clinics.
The project was tested in limited capacity during 2013 Allahabad Kumbh Mela. Gaining experience with Harvard's extensive research there, mCounter was redeployed in 2015 at Nasik Kumbh.
The system that we institute in Nashik was not parallel to what the government was doing, but that it is integrated into health systems.
My first thoughts were that this is some kind of an academic/research exercise, and whether we will be able to handle this in addition to everything else that we have to do. Then slowly, as we had that communication with each other, and as I understood more and more how this whole thing is going to play out, we agreed to do it.
Public Health Department Maharashtra, with Harvard Sai team, organized a 3-day training program for the entire crew of medical personnel to ensure an effective healthcare service during the Mela. The third day of this program was completely focused on the training for the Jan Swasthya application. This time, it became unprecedented in its scale. A whopping 35 of the 56 health units in the Mela area were equipped with mCounter installed tablet computers.
In Nashik and Trimbakeshwar, multiple clinics were set up along the routes at which the pilgrims would come to the bathing sites.
This helped in checking any contagious disease entering the Mela.
Trying to track the patient flow and what kind of diseases are they coming in with, tracking them for whether they are coming for a follow-up visit.
100 doctors were trained for 2 months regarding the operation of M-Counter to make them comfortable using the system. A team of 12 researchers from the Harvard side were kept on site at all times for training, monitoring and support. Medical students from across the country volunteered round the clock in the project.
So we had roving teams of 2 or 3 who had to cover every single clinic, and I think we had covered the 38 busiest clinics out of the 55.
Doctors in these units entered few basic information such as age, gender, location, chief complaint and diagnosis in the digital form. This information was enough for the purpose of disease surveillance. Collected information from all units automatically got uploaded in cloud server and generated easy to understand graphs and charts on a remotely accessible password protected dashboard.
It was not a static image, it was a dynamic tool that could be interrogated. As you click through various parts of the graph, it readjusts to give you more information.
The project became one of the largest successful health information systems rollout anywhere. In all, the medical officers entered more than 36,000 entries in 9 days of clinic operation, averaging over 4,000 entries per day. It did serve its purpose, as the government officials quickly adopted the system.
There was actually ground level action that was taken based on this information.
The local health administrators noticed a spike in gastroenteritis and just presentations of upset tummies and diarrhea. They interrogated the dashboard. They found that oddly the majority of those were being reported at this one particular clinic.
The management can understand within a second that at this spot there are the many patients of diarrhea. It may have the problem in water and food. They came there and tried to solve it.
There is always a need to test health interventions to improve public health and safety. Kumbh Mela, owing to its predictably unpredictable nature, provided an excellent opportunity to that end.
So for the first time in India, we had real-time syndromic disease surveillance available at the fingertips of all these policymakers.
This is a great boost for the Government of Maharashtra Health Department because they have collected minute-to-minute program. Not only that, how many patients are there of the fever, how many patients of diarrhea, in which area exactly what infection is on.
If they have this sort of a connectivity where each and every patient they see gets entered into a common database so that preventive steps could be initiated in a very swift way.
And that is the beauty of this whole exercise, and perhaps that is where we are hoping that it would be useful for people in the future.
The way M-Counter was adapted and the response it generated goes on to show that India is ready for widespread mobile health intervention. The other component of the Jan Swasthya project was a mass screening program for oral health, hypertension and diabetes, offered to pilgrims, sadhus, security forces and the residents of Nashik and Trimbakeshwar. A total of 1.85 lakh patients were treated during the Kumbh Mela.
We treat every patient who comes in as a client who has to go back completely satisfied.
So I think we have a tool that is ready to be deployed for mass gatherings anywhere. It's easy to use, it's low resource, it integrates well with existing health systems.
It has relevance to how major congregations happen. It's going to be a marked shift from the way things have been working and to the way things can happen tomorrow.
This will be a starting point of new health policy.
At a stage as big as Kumbh, it is an understatement to say that this was an outstanding achievement.